The coronavirus outbreak in the U.S. is getting more dire by the day. Estimates show one American is dying from the virus every 30 seconds, and another 70,000 are expected to die before the presidential inauguration later this month. The U.S. is also breaking hospitalization records once again. More than 125,000 Americans are being treated in hospitals nationwide, and experts warn those numbers are expected to get worse as the holiday surge catches up. Meanwhile, the variant spreading across the UK has been discovered in dozens of countries, including the U.S. Colorado, California, Florida, and now New York have all reported cases of the more infectious strain. Jonathan Vigliotti has the latest from Los Angeles.
Southern California hospitals are so overwhelmed, one doctor calls it World War III. The emotional toll off the charts.
This is the worst medical disaster that I've seen in over 30 years of practicing in emergency medicine.
Los Angeles County now averaging 133 deaths a day. It was 25 on Thanksgiving. Bodies now stored in refrigerated trucks.
We're losing on average a person every 15 minutes.
And cases skyrocketing, over 800,000 since the pandemic began, nearly half of those since December 1st. Tonight, the first confirmed case in New York of that variant strain from the UK, at least 50% more contagious. The Saratoga County resident had no known travel history. California today seeing at least 5 more cases of that strain amid concerns of a wider U.S. spread. Tonight, British Prime Minister Boris Johnson extended his nation's lockdown through mid-February.
And it's been both frustrating and alarming to see the speed with which the new variant is spreading.
The virus also spreading quickly among some major U.S. retailers, including 174 employees of this Washington State Costco store who tested positive. But even as cases and hospitalizations keep soaring, more Americans packed airports on Sunday than on any single day since the pandemic began.
I don't want to let COVID kind of stop us from enjoying life or having something to look forward to.
Health officials now fear a crushing Christmas and New Year's surge with thousands of more deaths and more grieving family members like those of Millie Rivera, who would have turned 55 this month. Her sister wrote, "I watched you through the glass door. It broke my heart to not be able to be there. This is so unbelievable and not right." And Rivera had 9 grandchildren. Across Los Angeles tonight, long lines as people wait to get tested. Nowhere longer than Dodger Stadium, where up to 13,000 people are tested every day. The wait, up to 5 hours. Elaine?
Jonathan Vigliotti, thank you. U.S. vaccination efforts have fallen far behind schedule. More than 4.5 million doses have been administered. That is far below the 20 million expected by the end of 2020. Now, the FDA is expected to consider cutting doses in half for one vaccine to speed up distribution. Manuel Bojorquez reports.
Long lines in Florida, Tennessee, and Texas are where overburdened systems meet overwhelming demand.
I have high blood pressure, I have diabetes, I have susceptibility to pneumonia, and I'll wait a whole day for this if I have to.
Florida's governor pinned the problem on some hospitals.
Hospitals that do not do a good job of getting the vaccine out will have their allocations transferred to hospitals that are doing a good job.
But the governor's decision to open up vaccination to anyone over 65 ahead of some essential workers has added to the crunch. Dr. Robert Goldser says Mount Sinai Medical Center in Miami Beach has 10,000 people scheduled.
So you're going as fast as you can right now.
We're going full tilt. We're going till 7 p.m. at night, Saturday and Sunday.
The debate is now turning to giving half doses of the Moderna vaccine to people between 18 and 55, doubling the amount of people who can take it.
We know it induces identical immune response, and therefore we are in discussion with Moderna and with the FDA.
In Britain today, another first. Oxford and AstraZeneca's vaccine started to roll out. It will likely be months before that can happen in the U.S. Meanwhile, vaccine sabotage is adding to the problems. This afternoon, Stephen Brandenburg appeared before a judge in Wisconsin, accused of attempting to spoil hundreds of doses at a hospital outside Milwaukee, where he worked as a pharmacist. Prosecutors say Brandenburg believed they were unsafe. There is progress. In Queens, New York, nurse Sandra Lindsay, who famously received one of the first doses of Pfizer's vaccine, got her second dose to complete the vaccination.
The burden feels definitely much lighter today, and I am very, very grateful.
New York's governor is threatening to fine hospitals up to $100,000 for not using up their supply of vaccine within 1 week. Here in Florida, the governor is looking at turning COVID testing sites and even houses of worship into distribution centers, as well as adding 1,000 more nurses. Elaine?
Manuel Bojorquez, thank you. For more, let's bring in Dr. Richard Besser. He is the president and CEO of the Robert Wood Johnson Foundation and the former acting director of the CDC. Dr. Besser, welcome. Thanks very much for being with us. Only a handful of states have administered at least half of their vaccine doses. Many states are far behind. How do we improve both distribution and administration of these vaccines?
Yeah, you know, Elaine, this is a real challenge. One of the challenges was that states did not receive additional resources to be able to staff up and prepare adequately to be able to do this. And thankfully, Congress passed the bill and the president signed to provide additional resources to states to get this done. But it's going to take a while, and there are going to be speed bumps along the way. And the critical thing, Elaine, for people to recognize is that this winter, it's not the vaccination that is going to keep us safe. It's following the recommendations of public health. It's ensuring that people keep apart and social distance, wash their hands, wear masks. It's encouraging people not to travel, since that is a way that this is spreading around the country. And then it's recognizing that the relief that Congress provided will expire for most people by the end of the month. And they're going to need more resources if people are going to have what they need to be able to stay home when they're sick, to be able to stay home if they've been exposed to someone who has COVID. Without that, we're going to continue to see the disparate impact of this pandemic on people of color, on lower income people across America.
It's really such an important point that you make there, Doctor, because it is all connected in that way that you just spelled out. Well, President-elect Biden has said that his goal is to have 100 million doses administered in his first 100 days in office. Is that realistic?
Well, you know, I always think it's a better idea to underpromise and overdeliver. I've been encouraged by seeing the people he's bringing on board to head up this effort, to head up vaccine distribution and testing efforts. It's a really top-notch team, but it's going to take a lot of work to get from where we are today to being able to vaccinate a million people a day across America. It can be done. With a proper support from the federal government, with sharing of best practices. We've seen some states that have been able to step up and vaccinate almost around the clock, states that have been able to vaccinate people fully who are in nursing homes, and that's encouraging. So what can we learn from those states for those areas that are having trouble, and how can we rally around to make sure that every state has what they need to get this job done?
Meanwhile, the FDA is expected to meet this week to consider cutting doses of the Moderna vaccine in half to get more Americans vaccinated. Could that impact its effectiveness?
Well, I think that's a really important question. You know, there's been a lot of concern by many people in the public about politicization of science. And so it will be really important to see what kind of process the FDA undertakes if they're going to consider administering a vaccine in a way that wasn't studied as part of the formal study for approval. You know, I watched very carefully the advisory committee to the FDA as they considered the approval of the Moderna vaccine, and they were not considering using any schedule apart from that which was studied in tens of thousands of people and found to be safe and effective. So I'm concerned. And if you think about what's going on around the country, it's not that states have run out of vaccine. It's that states haven't been able to distribute and vaccinate fully the doses that they're getting. So I'm not seeing the bottleneck being that we're running out of doses. And it is encouraging to hear that Moderna says they're going to be able to manufacture more doses than they originally thought.
Meantime, foreign health experts warn that a COVID variant that emerged in South Africa may be resistant to our currently available vaccines. Doctor, how concerned are you about this? What do we know about this mutation?
Well, one thing we know about viruses is that they mutate constantly. It's what viruses do. A lot of the mutations have absolutely no effect on the virus's survivability or how well it transmits. Some may make a virus less severe and some make it more severe. Here, it's still an unanswered question whether this mutation that they found in South Africa will have any impact on vaccination at all. It's important to ask the question. But until those studies are done, I don't think that there's any evidence that vaccines will not work for these strains. But it's important that surveillance is done around the globe as the virus changes to make sure that not only are vaccines still effective, but other treatments that are being rolled out for COVID to make sure those are effective as well. The other question is to ensure that people who've had COVID with the non-variant strain, that they're protected from this new strain. These are all things that scientists are studying.
Mm. Well, another COVID strain is spreading in the UK. British Prime Minister Boris Johnson announced a new national lockdown Monday, and now New York has joined a growing list of states here in the U.S. in which the strain has emerged. Dr. Besser, should the U.S. consider a lockdown as well, and what do we know about this particular virus strain?
Yeah, I think the broad-based lockdowns that we saw back in the spring are not the approach that we need to take. We need to do those things that we know will reduce transmission and allow people to live their lives in ways that we know are much safer. So, for instance, we've been able to see that getting children back to school in many places has been done safely. So you don't want to shut down things that have been shown to work. But we do need to pay close attention here. The information out of the UK is concerning. The strain is not more severe, so it doesn't cause more hospitalizations. But the fact that it may transmit more easily will mean that more people get infected, more people will be hospitalized, and more people will die. So we have to pay close attention, and if there are things we need to roll back in terms of the type of interactions people have, that there's a recognition by the public that this is something that will be done in order to try and improve people's safety. But I worry when I go out and I see people not wearing masks, when I see stories like the one you shared of people traveling readily on airplanes. This is the time we have to just bite the bullet this year and recognize that we can't go back to many of the things that we want to do when this is over. If we come together, we can save lives now until there's enough vaccine in enough people to finally say goodbye to this pandemic.
Well, the U.S., as you know, has surpassed 350,000 coronavirus deaths this weekend, but experts say we have yet to see the peak of the holiday surge. What can we expect in the coming months? And Dr. Besser, are there any reasons at all to be hopeful?
Well, I am hopeful. I'm hopeful by the fact that we have two vaccines that are approved for use in the United States, that we're going to see an increasing rollout of those vaccines so that our healthcare workers are protected, our loved ones are protected, eventually enough vaccines so that everyone who wants to get it is protected. That gives me great hope. What gives me concern is that it took so long for Congress to come together to provide support to everyday Americans so that everyone in our country could do what they need to do to protect themselves, their families, and their communities. We've seen, as I said before, a disparate impact of this pandemic, in particular on people of color. And if we don't see Congress stepping up in a big way after the inauguration, providing ongoing unemployment assistance and providing rental assistance, mortgage assistance, bans on evictions. If we don't see those things coming forward, we're going to continue to see just incredible impact on people of color and people all across our nation. And if we don't, as a nation, come together and recognize that following the leadership of public health is the best way forward, it's the way forward for health, it's the way forward for our economy. If we don't do those things, we will see hundreds of thousands of people more die in this country, many of those deaths which could be prevented.
Dr. Richard Besser, Dr. Besser, really grateful to have your expertise and analysis. Thank you very much.
Thanks very much, Elaine.